We've done several reports now, building on the WHO Commission on Social Determinants of Health that I led. We did, at the invitation of the British government, the so-called Marmot Review, which we published in 2010 as Fair Society, Healthy Lives. And as part of the implementation of that, we've been working with cities. Coventry became a Marmot city. We're working with Greater Manchester. And now I'm delighted that we're going to be working with Cheshire and Merseyside. We did produce a report, the Marmot Review 10 years on, in February 2020, just before the pandemic crashed, pointing out that not such good things happened in the last decade, not the kind of action we would like to have seen happen. And then 10 months later, we produced yet another report, the COVID-19 Marmot Review, which we called Build Back Fairer. And that's really the basis of the work we want to do with Cheshire and Merseyside. In my original Fair Society, Healthy Lives, the 2010 Marmot Review, we had 6 domains of recommendations. And in Build Back Fairer, we suggest there needs to be action on those 6, yet again, even more so. Number 1, give every child the best start in life, so early child development. Number 2, education and lifelong learning. Number 3, employment and working conditions. Number 4, everyone should have at least the minimum income necessary for a healthy life. Number 5, healthy and sustainable places in which to live and work. And number 6, taking a social determinants approach to prevention. But then, when we looked at the fact that we had both done rather badly in terms of health nationally in the decade from 2010 to 2020, and we'd handled the pandemic very badly, we said, as well as focusing on those 6 domains, we've got to look at a higher level. Why had we done badly coming up to the pandemic, and why had we handled the pandemic so badly? And I suggested the explanation might lie at 4 levels. 1, the quality of governance and political culture. 2, the fact that we'd had growing economic and social inequalities. 3, the disinvestment from public services. And number 4, we weren't very healthy. So Build Back Fairer has to address all 4 of those: the quality of governance and political culture, the growing social and economic inequalities, the disinvestment in public services, and the fact that we're not very healthy. So we said, put equity of health and well-being at the heart of all government policy as we seek to build back fairer. The leadership has to come, in a Marmot community, the leadership has to come from local government, from city government, not just the health people. The health and social care, integrated care systems are very important, but that's not where the prime leadership should come. The prime leadership should come from the city government or the local government. It should involve integrated care services, the ICS are terribly important, and it should involve the community, the voluntary and community sector, and get community groups engaged. I mean, Coventry, if I believe this, I don't know, but when Coventry was declared European City of Culture, they claimed to me part of the reason they won that accolade was because they were a Marmot city. I said, oh, come on, you're just saying that. You say that to all the boys. I don't believe it. And they said, no, because as a Marmot city, we engage right across the whole city with all the sectors. And that was part of our bid to be a city of culture, the fact that we engage all the relevant sectors. So a Marmot city should engage all the relevant sectors: education, the police, the fire and rescue services, as well as integrated care systems, public health, and local government. Integration across the sectors is vital. I mean, firstly, working across the sectors is vital because the key social determinants of health lie outside the healthcare system. But then integration is vital because you can do more together than you can separately. And getting the different sectors working together is a vital part of getting this cross-sector action.